Welcome to today's video, where we're going to explore a condition that many people are facing but few fully understand what it really means when your hepatitis B surface antigen test is positive, yet your viral load is in the normal or undetectable range. At first glance, this may seem like a contradiction. If the virus is present, why isn't it multiplying? And if it's not multiplying, why is the test for the surface antigen still positive? For many, this lab result combination sparks anxiety, confusion, and a flood of questions. So in this video, we're diving deep into the medical science, the interpretation of these test results, and more importantly, what this means for your liver health, your long-term risks, and the best course of action moving forward. Let's begin by first understanding the basics of hepatitis B and the body's response to it. Hepatitis B is a viral infection caused by the hepatitis B virus, or HBV, that targets the liver. It's transmitted through exposure to infected blood or body fluids, including through sexual contact, childbirth, and shared needles. Unlike many other viral infections, HBV can exist in the body silently for years, causing little or no symptoms, all while it continues to interact with the liver and immune system in subtle ways. This unique behavior is part of why interpreting hepatitis B test results can be complex. In the U.S., about 860,000 people are living with chronic hepatitis B, many without even knowing it, and the condition continues to be a significant public health issue, particularly among certain populations like Asian Americans, African immigrants, and those born in countries where HBV is endemic. Now, when someone is tested for hepatitis B, one of the first markers doctors look at is the hepatitis B surface antigen, or HBsAg. This is a protein found on the surface of the virus itself, and its presence in the blood indicates that the virus is circulating in the body. If HBsAg is positive for more than 6 months, it's considered a chronic infection, but this doesn't mean the virus is actively replicating or damaging the liver at that moment. It simply means the virus hasn't been fully cleared by the immune system. And here's where the second test becomes crucial, the viral load test, also called the HBV DNA test. This measures how much of the virus's genetic material is present in the bloodstream, essentially revealing how actively the virus is reproducing. A high viral load suggests that the virus is in an aggressive, replicative phase, while a low or undetectable viral load indicates that the virus is either dormant or under control. So what does it mean when these two tests show what seems like conflicting information? A positive HBsAg tells us that the virus is present, but a normal viral load suggests it's not currently replicating in large quantities. This situation is actually quite common and typically points to what's known as the inactive carrier state of hepatitis B. In this state, the virus is essentially sleeping. It's present, but not active. The immune system has established a kind of truce with the virus, suppressing its ability to replicate and minimizing liver inflammation. People in this phase often have normal liver enzyme levels, no symptoms, and can live for many years without any problems. In fact, many people in the inactive carrier state may never experience significant liver damage as long as they're carefully monitored. However, being in the inactive carrier state doesn't mean that you are cured or completely safe. Hepatitis B is a complex and dynamic virus, and the inactive phase can shift to an active phase over time. That's why it's essential to undergo routine monitoring, including regular testing of liver enzymes like ALT and AST, viral load checks, and liver imaging when necessary. These checkups help your healthcare provider catch any signs of disease, reactivation, or liver damage early, before symptoms appear or complications arise. It's also crucial to keep in mind that changes in your immune system, like during chemotherapy, organ transplantation, or treatment with immunosuppressive drugs, can wake the virus up from its dormant state, leading to a sudden increase in viral replication. This phenomenon is known as HBV reactivation and can be dangerous, even life-threatening if not managed proactively. Furthermore, not everyone with low or normal viral load fits neatly into the inactive carrier category. There's also a group of people who are classified as having chronic hepatitis B infection with low replication. These individuals may have fluctuating liver enzyme levels, mild liver inflammation, or early fibrosis despite a relatively low viral load. In these cases, the virus is still exerting a low-grade effect on the liver, and the risk of disease progression remains. Such individuals may not need immediate treatment but should be monitored more closely, and some may eventually qualify for antiviral therapy based on changes in liver health indicators or family history of liver cancer. A particularly important aspect of managing hepatitis B is understanding that even with a low viral load, there is still a risk, albeit reduced, of transmitting the virus to others. This is especially true for sexual partners, household members, and newborns during childbirth. While a low viral load means less circulating virus, it doesn't mean the virus is entirely absent. Blood, semen, vaginal fluids, and even saliva can still carry traces of HBV, which can be transmitted under certain circumstances. That's why it is strongly recommended that people who test positive for HBsAg ensure that their close contacts are screened and vaccinated if they are not already immune. The hepatitis B vaccine is safe, effective, and one of the most powerful tools we have for preventing transmission. So, should you be worried if your HBsAg is positive but your viral load is undetectable? The answer depends on your broader health picture. If your liver enzymes are normal, you don't have signs of liver scarring, and imaging studies are clear, then there's generally no need for treatment. Instead, your doctor will likely recommend regular monitoring every 6 to 12 months to ensure that nothing changes. This monitoring might include tests for liver function, viral load, and an ultrasound of the liver, especially if you're over 40 or have a family history of liver cancer. This approach is designed to catch any changes in the status of the infection early, allowing for prompt intervention if necessary. But there are some situations where treatment might be considered even with a normal viral load. If your liver enzymes are elevated, or if imaging shows signs of liver inflammation, fibrosis, or cirrhosis, your doctor may still recommend antiviral medications to suppress the virus further and protect the liver. Additionally, if you are planning to undergo chemotherapy or immunosuppressive therapy for another condition, preventive antiviral therapy is often started to avoid HBV reactivation. In pregnant women who test positive for HBsAg, doctors monitor viral load closely throughout the pregnancy. If the viral load is high, they may prescribe antivirals in the third trimester to reduce the risk of mother-to-child transmission. Even with a low viral load, newborns are given both the HBV vaccine and hepatitis B immune globulin shortly after birth to ensure maximum protection. Long-term complications of hepatitis B, even in those with normal viral load, can include progressive liver fibrosis and an increased risk of hepatocellular carcinoma, or liver cancer. While this risk is significantly lower in inactive carriers, it is not zero. This is particularly true for individuals with a family history of liver cancer or those who also have other risk factors like fatty liver disease, obesity, or alcohol use. Therefore, liver ultrasound and blood tests for alpha-fetoprotein, a tumor marker, are often part of routine surveillance in chronic HBV management, even in patients without active replication. This brings us to lifestyle. If you're living with chronic hepatitis B, even with a low viral load, making healthy lifestyle choices is vital to reducing liver stress and supporting immune function. First and foremost, eliminate alcohol completely, as it can accelerate liver damage. Avoid smoking, which independently increases the risk of liver cancer. Eat a balanced, nutrient-rich diet that's low in processed sugars and saturated fats to prevent fatty liver disease. Incorporate fruits, vegetables, lean proteins, and whole grains into your meals. Maintain a healthy weight and stay physically active, as obesity is a known contributor to liver inflammation. Avoid unnecessary use of medications and supplements that may be harmful to the liver, and always consult your doctor before taking over-the-counter drugs, herbal products, or alternative therapies. It's also important to protect yourself from additional liver insults by getting vaccinated against hepatitis A, which can cause severe complications in people with existing liver conditions. If you're diabetic or have high cholesterol or hypertension, keep those conditions well managed, as metabolic syndrome can worsen liver disease outcomes. On a psychological level, living with hepatitis B, even in an inactive state, can be stressful. Many individuals struggle with anxiety, fear of transmission, or social stigma. This emotional toll can be especially difficult if people around you don't understand the condition or react with fear or judgment. That's why education, awareness, and support systems are vital. There are organizations like the Hepatitis B Foundation that offer resources, community support, and up-to-date information that can empower you and your family to navigate this condition with confidence and clarity. To recap, testing positive for HBsAg with a normal viral load generally means you have chronic hepatitis B in an inactive state, or at least in a controlled phase. While that's good news in terms of current liver function and risk, it doesn't mean you're cured. You still need regular follow-up care, liver health assessments, and lifestyle management. You may not need treatment right now, but staying on top of your condition can prevent complications down the road. It's not something to ignore, but it's not something to panic about either. If this sounds like your current situation, the best step you can take is to stay connected with a knowledgeable healthcare provider, preferably a liver specialist or infectious disease expert, who can guide you based on your individual health status. They'll help you determine the right monitoring schedule, recommend appropriate lifestyle changes, and keep you up to date with the latest advances in hepatitis B research and treatment. And remember, with the right support and vigilance, people with chronic hepatitis B can and do live long, healthy lives. Thank you for watching today's video. We hope this gave you a clear, comprehensive understanding of what it means to have a positive hepatitis B surface antigen with a normal viral load. If you found this content valuable, please hit the like button, subscribe to our channel, and share this video with friends or family who may benefit from it. Have questions about hepatitis B or liver health? Drop them in the comments below, and we'll do our best to answer or address them in future videos. Until next time, stay healthy, stay informed, and take care of your liver, because it's one of the most important organs you've got.